Hi, I'm Dr. Caplan from Helios Telemedicine for Longevity. Testosterone use is exploding in the United States, both for true medical indications and for frivolous, muscle building, or perceived longevity uses. Leaving aside why, if you are thinking about starting testosterone therapy, you need to know the risks, side effects, and complications of TRT. Conventional thought was that testosterone replacement increased your risk for heart disease or caused prostate cancer, but numerous studies have shown that this is not the case. Replacing testosterone in men with low testosterone eases or eliminates so many cardiac risk factors that it seems obvious that it wouldn't cause heart attacks in the well treated men. I can't speak to those who take supratherapeutic doses. So, what do we have to worry about? The first thing is that testosterone replacement therapy is almost always permanent. If you are legitimately low T, then you shouldn't worry about this too much. But if you are juicing or taking it even though your baseline levels are clearly normal, then you should know that you will likely have to stay on it for the rest of your life. Stopping will result in T levels lower than what you started with. Testosterone therapy suppresses the control axis from stimulating your testes from making testosterone naturally. It also suppresses the testes from making sperm, so sperm counts may plummet, rendering you infertile. Fertility specialists may be able to raise your sperm count enough to use in vitro fertilization successfully, but that is not guaranteed. If you are planning on having kids after starting TRT, make sure to ask for treatment to try and maintain your fertility. Another aspect of this suppression is possible shrinkage of the testes. They won't go back down to prepubertal size, but they may shrink enough to be noticeable, which can be bothersome to some men. Others have said that they just make for smaller targets or were less likely to be crushed when going over bumps on bicycles. This may also be minimized by the same medications used for fertility preservation. Testosterone stimulates the bone marrow to produce red blood cells, so if the count goes too high, it increases the viscosity of the blood, theoretically increasing the risk for slow flow strokes or blood clots, and the dosage may need to be reduced, or you may have to donate blood to bring the count down. Testosterone does not cause prostate cancers, but it does go to the prostate where it is converted into dihydrotestosterone, which can stimulate the gland to grow, increasing the risk for developing benign prostatic hypertrophy and problems urinating. And it could theoretically stimulate the growth of a prostate cancer that is already there or develops in the future. The same testosterone to DHT conversion occurs in the hair follicles and could contribute to earlier male pattern hair loss. Testosterone is metabolized in the liver, so it could cause some liver damage. Some testosterone preparations can be taken by mouth, but others not at all. So be cautious when considering what therapeutic regimen you're going to take and discuss it with your physician. Finally, as we raise testosterone levels in the body, there is more free T available to enzymes in the fat cells, leading to more conversion to estradiol and high estradiol levels. This can lead to weight gain, erectile dysfunction, emotional instability, fatigue, and other symptoms of elevated estradiol. All that said, I regularly treat patients with testosterone or medications to stimulate testosterone production. It is so exciting and satisfying to see patients with amazingly positive changes in their lives when their symptomatically low testosterone levels are raised to their true normal levels. If you're thinking of starting on testosterone replacement therapy, I would love to guide you in your decision. Click the Schedule an Appointment button at www.heliostelemedicine.com to set up a visit with me. I can speak to anyone from anywhere and can order tests and medications in my licensed states of Texas, New York, Florida, and Missouri. The first appointment is only $49. Thank you for your time and attention. Bye for now.